Hi everybody, my name is Jeff Cook and I am Vice President of Beneficial Benefits. And I'm here today to give you a primer of the Affordable Care Act. Now we're going to take a look at the history of the Affordable Care Act. It was passed in 2010, what 2014 looked like when it actually officially became law on January 1st of 2014, and where we're at today in May of 2015 and what we can expect from here on in. And frankly, folks, I'm a little concerned. I'm not concerned about you all who represent beneficial benefits of getting the word out to not only individuals but groups, but I'm concerned about citizens of the United States, residents of the United States that are having insurance policies that have $6,000 deductibles. See, what's happened as an unintended consequence, and I believe it's unintended until I hear otherwise, but I think the unintended consequence is when this came into law, we saw the prices increase when the benefits went down. Take a look at the increase from fall of 2013 and the open enrollment that everybody went through, and then fall of 2014. And if you think we've seen the worst of it, I have some terrible and grim news for you. We haven't. It's going to get worse, and I'm going to explain that in a little while because of the way that the law is written. So I'm afraid that people aren't going to be able to afford their treatments. And what happens when that takes place? It breaks down the system. When it breaks down the system, that means more of us pay. Why do you think we're in business for voluntary benefits? It's to help our fellow citizens be able to keep their hard-earned money and only pay when absolutely necessary for like surgeries or anything else like that, because they have deductibles and they're high. A family deductible on what we call a catastrophic health care plan is $12,500. Take a look at the employer deductibles now under the new employer law, what they have to come up with. For the first time, we're hearing widespread situations of prescriptions now being under a deductible instead of having a copay. When have you heard of that before? Well, frankly, folks, I grew up in the insurance industry, and a lot of changes have happened in a very short period of time. 5 years is a short period of time when you take a look at the timeline of insurance from when we started being able to cover people 50, 60, 70 years ago to where we're at today. So this primer is to help you understand where we've been, where we are, where we're going, and how we can work to help them here at Beneficial Benefits. So I'm going to continue this right now. The reason why this is here is because you're going to learn the history, you're going to learn the effects on businesses and individuals, you're going to learn the schedule as mandated by law, you're going to learn of the types of insurance coverage that happens to be there, and you're going to learn about the health exchanges. Even the health exchanges in the states right now are at risk. They're losing money. They're unsustainable. But the history was introduced by Congress, amended, passed, and signed into law by President Barack Obama on March 23rd of 2010. It's designed to make health care affordable to those uninsured and those with pre-existing conditions. It was based on the premise that the 35-year-old and under group would make up 20 to 25% of the total demographics of the Affordable Care Act, of those being covered. That's what it was based on. And the period of time that they're going to base that sample on has already come and gone. January 1st, 2014 through March 31st, 2015. We haven't heard those results yet. And I'm fearful we're not going to hear those results until not long before we have open enrollment starting on October 1st of this year, because that's going to have a major effect of what's going on. Now, the intention of the ACA was to bring in competition that really would drive insurance premium costs down by introducing a new and younger segment of the population to the universe. That's the ones I was talking about, under 35. Well, they're instead of the 20 to 25%, they're estimating it might be 5 to 7%. How do you take something that's been reduced 75% in the demographic model, and how do you keep the price sustainable for those of us, the average working Americans? That's a problem. These insurance policies would be offered through state exchanges or via the U.S. government in the event that a state opted out of the exchange. It was challenged in court by a majority of attorney generals serving 50 states of the United States. The Supreme Court in June 2012 ruled that the Affordable Care Act was indeed constitutional, as the penalties were taxes imposed by the Internal Revenue Service. The implementation of the Affordable Care Act was to begin in tax year 2014. Now, I want to add a side note to that. Here's challenge number 2. We've already talked about the demographics. In front of the Supreme Court, they have already argued in front of the justices of the Supreme Court the constitutionality of the tax credits for those who couldn't afford it. Tax credits could make up to 100%, a total of 100% of their entire premium. But that was estimated on what they thought their tax return was going to be based on their income. If there's anything different on that, they have to pay the difference. Well, in the states that don't have exchanges, the tax credits are being challenged as unconstitutional. If the Supreme Court rules that it is unconstitutional, and we'll know in less than 2 months, then what does that do to insurance rates when open enrollment happens this fall? You see that there's a double-edged sword coming our way. That is the demographic and the Supreme Court actions. That could be a double bomb that will hit the ACA. And if that's the case, we're all going to pay a lot more money than what we're paying right now. Since many businesses were unprepared for such a rollout, President Obama granted businesses a 1-year grace period to begin implementation, in effect allowing them an extra year to be prepared and not be penalized by the process. The first year for compliance by businesses is actually this year. We're in it right now. And we'll get into that in just a second. But individuals were mandated to register for insurance through healthcare.gov beginning in October of 2013 for the 2014 tax year. If covered by an approved business insurance plan provided by the individual's employer, and that also would include the spouse, family, the whole 9 yards, that individual was exempt from penalties. Subsidies are provided for those who meet certain income family size guidelines. And remember, I said up to 100% discount. However, this would also be verified months later by the individual's 1040 tax form. And we just got through tax season for 2014, except for those who have filed for an extension. From this point on, the presentation now will focus on business mandates in this year and the individual mandates that actually started last year. First of all, the employer mandate. Is it really needed? Well, initially, they required businesses of 50-plus employees to offer insurance by January 1st of last year or face a penalty if at least one of their full-time workers gets subsidized marketplace coverage. Well, that mandate was delayed now into 2015, and then it was changed again to where this year in 2015, instead of 50, it became 100. And there's also a couple other things. The percentage of that 100 also changed. We'll get with that in a second. So the business mandates for this year, all businesses with 100 and over FTEs, that means full-time employees, must provide health care. It's a 70-30 rule for this year. 70% of all full-time employees must be covered. Now, if a spouse has coverage that includes that person working in the employer, that counts, okay? The IRS penalty for noncompliance is $2,000 per employee not covered. It's actually a little bit more than that. I believe the amount is $2,084, and it's divided into 12 monthly payments. They pay it on a monthly basis, and it's $2,084 times the number of employees that didn't meet the 70%. So if it was 65% and it was exactly 100, that means 5 times 2,084. Hope that makes sense. Employee wellness became a priority through the ACA, and it's based on a questionnaire completed by the employee. You're going to see that with every one of them from here on in. Now we get into 2016, and all of a sudden the 100 rule goes down to 50. And over 50 and over full-time employees must provide health care. Instead of 70-30, it now becomes 95%. 95% of all full-time employees must be covered. We have seen what businesses have done to cover that. Hiring 2 part-timers, less than 30 hours a week, less than 1,200 hours in the course of a year to make up 1 full-timer. So that's how a lot of companies that are large companies have gotten around this. IRS penalty for non-compliance is still $2,000, actually $2,084 per employee, still broken up in monthly payments, and employee wellness is still a priority, and that's always going to be the case. Let's look at next year, and I'm talking about actually 2 years from now, 2017. We're still in the 95-5 rule. That's going to continue from here on in. But the compliance penalty goes to over $3,000 per employee not covered. Divided by 12, that's what's going to happen, and it's going to be a monthly charge to that business, unless for whatever reason this is changed in legislation. The employee wellness still continues on. So we get into 2018, and what's new? The compliance right now is being considered at $5,000 per employee. That's where it stands right now. It can change, but that's where it is. The Cadillac tax, and this is for what we really call the high-end Fortune 500 company insurance plans, starts going into effect for those types of businesses. Well, you've already seen the businesses that had Cadillac plans already scaled them back. Harvard University just did that, and there was a big article about that back in January. So Harvard University has already done that. There's other companies that have already scaled that back because they're planning for the year 2018. They're going to get hit hard if they don't make changes and start making the changes now. You just can't implement that and make that change in 1 year. It takes years to do it, and Harvard is one of several that has already done that. Now let's talk about the individual mandate. Well, subsidies are allowed based on income and family members as credits. The penalty for this year, for 2015, is greater than it was for 2014. Last year's was 1% of taxable income. We're talking line 34 on the 1040 form, or $95 per adult and half for children. Now, a lot of people thought, and this is talking with my accountant, that it was just $95. They thought, okay, I don't have to buy it. I have to pay $95. That's fine. Well, okay, that's good. That's if you're one person and you made $9,500, and that's on line 34. You would have to pay $95. How many people pay, or should I say make, $9,500 on line 34 across the United States? Very few. It's also 1/2 per child that's not covered, up to the age of 26 who lives at home. So, it was 1% of taxable income, or $95 per adult, and $47.50 per child, or the 1%, whichever was higher. Well, the 1% was, of course, naturally higher. And there were bills of $3,000, $4,000, $5,000 out there. Larger the family, the higher the bill if they didn't have a compliant policy. The exchanges offer the following plans, and this is still true: catastrophic, bronze, silver, and gold. And you can imagine that the prices go up and the benefits go up with each level. But gold, if you priced it last year in healthcare.gov per person, was over $900 per person. And it offered co-insurance like what we used to see, but it was over $900 per person. As a family, they were looking well over $2,000 or more per month. Not talking per year, per month. State-approved carriers were allowed. If state is not involved, then it's the United States government approved. That is where we're getting at with the tax credits. The individual mandate for 2016 is the penalty becomes the greater of 2.5% of taxable income, or $625 per adult. What you just saw in the 2015 was this year it's $325 or 2%, or $162.50 per child up to 26 years old who's living at home. Now it becomes in next year 2.5% of line 34, or $625 per adult, and $312.50 for children. Starts getting really serious now. Exchanges still do the same. It's approved carriers. I'm going to go back to that one screen on 2015 so you get an idea. $325 per adult for this tax year we're in right now. 2% of taxable income, or $325, and of course $162.50 per child up to the age of 26. It's the greater of the two. Next year, 2.5%, $625 per adult, $312.50 for a child. Still everything else is the same. But remember, we still have two things pending. The results of the demographics and, last but not least, the Supreme Court decision, the ruling, and they always save the most impactful ruling for the very end. So we're going to know about it right around June 30th. If it is ruled unconstitutional for those tax credits, if we find out that the 35 and under market is actually much smaller, or even a little smaller than the 20 to 25%, you can expect that somebody has to pay for it. And that somebody becomes the American public. Because it's certainly not going to come via way of the government. They're going to do their best to help us, but, there's only so much they can do. So, we go into 2017, and right now the penalty is still becomes based on an adjusted inflation numbers. It's still higher than 2016's penalty, but it's based on adjusted inflation. So we don't know what that's going to be yet. Still, subsidies are allowed until the Supreme Court says otherwise, and the exchanges are still going to be said as the catastrophic bronze, silver, and gold, unless we hear otherwise. So why does this all matter? And how can we use this to our benefit in beneficial benefits? Well, I'm glad you asked that question. The mandate of the Affordable Care Act with regards to businesses' insurance premiums have already been increased in preparation for the new mandated provisions that we're already in. This means to save employers more money, high deductible plans are becoming the rule instead of the exceptions. Prescription deductions are now in place, and they're becoming the rule instead of the exception. Since we offer individual medical savings and benefits, those with high deductibles that are $6,000, and there are actually higher ones than that, and little or no coverage until those deductibles are met, can use our benefits as a safety net. Think of us as gap benefits, not gap insurance, because we're not insurance. And we're not a replacement for the Affordable Care Act. But think of Teladoc with zero copay to be able to be triaged, and 95% of any time you go to the doctor can be done by telemedicine. That is a CDC study that came out in December of 2013 in anticipation of this particular act going into effect. All right? The same is true for business employees. Think of us as the cookie or the silver lining, whatever it is. Pennies a day, we can cover the entire family. There's no pre-existing conditions. There is no limitation on how many family members. There is nothing. There's no waiting periods. We're not insurance. We're benefits. We're medical savings and benefits. Think about dental. People don't even go to dental now because of the medical plans. The American Dental Association has now said that less than 8% of us in the United States have any kind of dental plan possible. Can you imagine that? 75% of the diseases we get come through the dental portion of our mouth, of our body, through the mouth. And only less than 8% of us actually have any kind of coverage. Well, we have that, and we actually rival insurance companies on most of those discounts. So what do you need to know? You need to know that, first of all, we're not insurance. We are a cost-saving and economically saving addition for business owners and individuals so that they can keep their hard-earned money and use their high-premium, high-deductible plan for true emergencies like surgeries, treatments, and other high-cost medical procedures. And oh, by the way, we have Medical Bill Saver that can help them with that too, so that those bills can get negotiated, as long as they're not turned into insurance. And it's a 25 to 50% savings at payments you can afford. That's one of the 4 pillars of beneficial benefits. Prescription savings with a transparent plan. Nobody in the middle. Number 2, teledoc, telemedicine with 0 copay for as many times as you have to call the doctor, and they call you back in 16 minutes or less. Number 3, the dental savings, dental access by Aetna. Truly, the break-even point between that and insurance is about a $130 procedure. And number 4, medical bill saver, that's going to save you all kinds of money on any of your, whatever it is that you've had done. Broken leg, hospital stay, you've had some kind of surgery. How many bills do you get on those? Anesthesiologist, the hospital, the doctor, the surgeon. You have them from everybody. You'll have 8 bills. It just happens. They'll do the hard work for you. So, teledoc, remember I was talking about that? Well, it's a big hit. 365 days a year, an elite medical doctor is available via phone to diagnose 95% of the calls received. And that's a CDC statistic. That is not what we're coming up with. In fact, with the flu last year in December and this year in January, the American Medical Association was saying, we don't want you in the waiting rooms if you have the flu. Well, why not just get triaged over the phone or via the computer using Skype in the comfort of your own home? Why not do that? And a prescription to the employee's pharmacy of choice or the individual's pharmacy of choice, and use that transparent pharmacy card, and you don't have to worry about an insurance company telling you that, I'm sorry, but we can't allow that prescription to be used. All of this without a copay or cost except for the medications. We're going to save you money on that too. Why do the HR personnel love this? It's because if a child is sick at night, which usually happens when a child gets sick, the parent can call in, get the proper diagnosis, and pick up the prescription in less than 2 hours. And 70% of the time not have to stay with the child the next day, because that first dose, remember it's usually a double dose, especially if it's an infection, is usually enough to send the child to school the very next day, and the employee doesn't miss out any time. Productivity saved, that's an HR director's nightmare. And no money out of pocket except for the prescription, which of course is one of our benefits. How about a second example? The dental benefits. Compared to Delta Dental, which is what I have, all procedures are at a lower cost, starting at about $120 to $130, and there's no having to meet a deductible. There's no maximum benefit. Root canals are $200 or more or less. There's no $1,000 cap on payments or $1,500 or $2,000 for the year. There's nothing like that. Best part, it's likely their favorite dentist is on the same list. There are 158,000 providers and specialists that accept our benefits. And here's one example. Braces today at the orthodontist where our 32-year-old son had his braces done back in the year 1997. We paid $2,800 back then, and it was broken up into monthly payments by the orthodontist. Now, braces through our insurance, after maximum benefit for the year and deductible, is $5,600, not including any extractions. With the same orthodontist, using the Delta Dental Access, using the Aetna Dental Access Plan, which is a benefits plan, not insurance. Those same braces are about $3,300, including extractions. Crowns, 25 to 40% less. Root canals, what about implants? You ever have a tooth that's missing and all the teeth start crowding there and the dentist says you're going to need to have bridge work? Well, you could have an implant, but insurance doesn't cover an implant. Well, the dental benefits from Aetna covers an implant. So think about how much money you have saved by not having to do bridge work, which is literally almost $1,500 per tooth. So you got to know your customer's pain and listen to them. You think of the benefit that can ease his or her pain. The pharmacy card is free. Take care of that. Use the examples. The two listed are appropriate, plus the pharmacy card. Know that the Affordable Care Act no longer covers hearing and vision in most plans. We have hearing and vision in one of our 3 plans, but we have the 4 pillars in all 3 plans that are possible. Then know the math, calculate the savings, and then you can close the deal, because it really makes sense for pennies a day that people can save that money. And the idea is to save them more than enough to have to pay their tax or put it on top of that ACA plan that's already gouging them right now. And it's not the employer's fault. It's because it's the way the insurance system is today because of the Affordable Care Act. Ladies and gentlemen, I appreciate your time today. I hope this has given you some information that you can use. What I'd like for you to do now is put it to action. Understand the Affordable Care Act. Understand what's there. Know it. Breathe it. You don't have to read it. I've read it 3 times, including the 22 pages that the IRS put in this year, just so that 2014 taxes could be done. Just understand how we can benefit somebody with an ACA plan. I appreciate your time. Thank you very much. Let's leverage beneficial benefits, but let's understand how we can help them when they have an ACA plan, because I haven't heard of one person yet who's happy with this year's insurance plan, and it's only going to get worse, and potentially much worse, when open enrollment starts on October 1st. Because in a non-election year, it's October 1st. In an election year, it's November 15th. You can think that one through and figure that out and tell you why. Thank you, ladies and gentlemen. Have a great evening.